Study analyzing the data of 92,000 people found that semaglutides were linked to a 33% lower risk of dementia. There's also evidence that they may reduce sleep apnea and seizures and can slow chronic kidney disease. There are even trials going on right now to see how products like Ozempic can be used to curb alcohol and tobacco cravings. Now, there are, of course, drawbacks. A lot of these benefits go away when you stop the injections, and they've also been linked to gastrointestinal disorders and pancreatitis. But still, the consensus right now is that the benefits of GLP-1 drugs far outweigh the potential drawbacks. In fact, the Trump administration is considering a plan that would see them covered under Medicare and Medicaid. Let's talk about it. Joining us is Dr. Archina Sadhu. She is a professor of medicine at Houston Methodist. Thank you so much for taking the time. So a lot of people call these miracle drugs. What's the catch?
Well, like any drug, there are side effects. It is surprising to all of us in the medical community how you're right. Every clinical trial that's coming out now, studying it for various indications, have had positive results. And we're not exactly sure how this drug is working in each of the situations. So the side effects are of concern. We know of the common ones, which are usually gastrointestinal, but the serious side effects of pancreatitis, potential links to certain thyroid tumors, gallstone attacks are all real, and they happen much more frequently than advertised.
I have a theory about all these benefits, like helping prevent dementia, kidney disease, stroke. How much of that is due to actually losing weight? And, you know, I wonder if that's maybe what's going on. I could be 100% wrong, but you tell me.
No, you're really right on the target there. We actually don't know how much of it is weight loss dependent. And when we talk about weight, we're not just talking about pounds on a scale. We're talking about a whole cascade of inflammatory and immunological reactions that are happening throughout the body related to the weight. Some things, though, I have to say, have been weight independent, but we really don't have a clear picture of how much of it is weight, inflammation, and other risk factors that go away when we lose weight. So these are all many questions that still need answers.
What happens when you stop taking the drugs?
Well, in terms of weight, at least it's been studied, the weight immediately rebounds and over time can go back to baseline. Now, it depends on what the individual does, of course, and this is what I advise my patients all the time. When they need to stop the drug, they can't afford it, or they can't tolerate the side effects any longer, is that the drug does teach the patient, the person that's using it, on exactly what type of diet and calorie restrictions are needed for them to maintain that weight. But if you were to do nothing different, unfortunately, the weight comes back. Whether the other benefits come back or not, or go away, I should say, we still don't know.
You mentioned affordability. I mean, covering these under Medicare and Medicaid would be a huge deal for millions of people because these drugs are still extremely costly for so many. When do we start seeing more access for the people who need it most?
Well, that is a big focus and has been a big concern for most of the clinicians prescribing these drugs. It's a great limitation, access to care and costs. We do have 2 GLP-1s now that are generic. They are daily injections, unfortunately, and not the preferred administration. But it is exciting to see that Medicaid and Medicare will be covering it as soon as next year, maybe definitely by 2026, if all goes as planned, because these are high-risk populations and would greatly benefit from the cardiovascular protection, the kidney disease protection, and liver potentially as well. So we're excited that the access is increasing. But again, you have to do patient selection, and you always have to do risk to benefit ratio in each individual patient.
Have you heard about the counterfeit versions of these drugs? What's going on with those?
Well, there was a shortage of these drugs for quite some time, and that was the opportunity to do compounded versions of these drugs, which many business owners took advantage of. A lot of telemedicine was prescribing these compounded, and still do. Now the shortage is officially over, so the FDA has advised that we do not use these compounded drugs for any indication. So I don't recommend it to any of my patients.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.